So you have Medicare, and you've heard that maybe you can get access to weight medications now through the Medicare Bridge. What is it? Does it apply to you? How do you get your doctor to prescribe it for you? How do you get your doctor or your clinician to understand how to make it work? So I'm Dr. Leslie Golden of Weight and Gold. We're obesity medicine practice in Wisconsin, and I'm going to walk through what the Bridge program is for you, what it is, what it means for you, and how to know how to get the most out of your appointment to make sure everybody that is involved understands, because just because it's available since July 1st doesn't mean that everyone knows actually how to help you access this benefit. So let's start at the beginning. So Medicare now covers medications through the Bridge program for weight management, obesity management medications. A lot of people call them weight loss meds, which is why I left that on here. But we really try to get away from that language because these medications don't just cause weight loss, they treat the underlying condition of obesity. And for some individuals, yes, weight loss may be a part of that, but also weight management and preventing weight from coming back on in order to, you will need to stay on the medications for most people. So let's talk about a little further who's eligible and how do we make sure we actually get this benefit. So Medicare, why do we even need this in the first place? So Medicare does not traditionally cover our medications that we use to treat weight. Many of you have probably experienced this if you have Medicare, but now they do, but through this special program. So why has this been an issue? So Medicare D, so that's our benefit that provides the prescription drug coverage through Medicare, was actually legally not allowed to pay for weight medications. So that's why individuals have not have access for it, even though they can get the medications potentially if they have other conditions. And potentially you could be paying significant amounts out of pocket. But now through the Medicare GLP-1 Bridge program, if you qualify starting July 1st, the medications can be available for you at $50 a month. And which medications are we talking about? Specifically, Wegovy, Foundayo, or Zepbound. And these medications, we have to be using them specifically for the purpose of weight management. So how do I know if I get the benefit? Well, you have to be enrolled with a Medicare Part D plan. So even if you have a Medicare Advantage plan, if you're enrolled in a Medicare Part D plan, then you're eligible for this. You have to be an adult 18 or older, and weight has to be the reason, or obesity has to be the reason that you're trying to seek access for this medication as the primary reason. If we're getting access to the medication for other indications, then we're not going to benefit for this. This has to be an individual that needs the medication specifically for weight regulation, since there's coverage through Medicare Part D for other indications that have been approved. So what does that look like? How do I know if I'm eligible? Because some of us may want to lose weight, but we may not medically need to lose weight because this is for treating clinical obesity. So when the amount of adipose tissue, aka body fat tissue, is interfering with health or life in some way. So what are the criteria that potentially get you the coverage for these medications? So here's this one pathway. If your BMI is 35 or above, that would make you eligible. If your BMI is 30, in addition to at least one of the following, you have to have a certain type of heart failure with preserved ejection fraction. So if you're not really familiar with your clinical picture, you're going to need your provider to help you work through this. You will need to have either BMI 30 or with heart failure with preserved ejection fraction, or high blood pressure not controlled on 2 medications, or kidney disease at stage 3A or higher. The other pathway, having a BMI of 27 with at least one of these: pre-diabetes, prior heart attack, prior stroke, or prior circulatory issues like peripheral arterial disease. Now, it's not today that you have these indications. It's at the time that you may have ever started treatment with a GLP-1 medication. So if you have access to that information, hopefully if you're working with your primary care provider or an obesity medicine specialist or an endocrinologist or a cardiologist that you've been working with for some time, they may have this information available because it's the BMI in this criteria at the time of starting any GLP-1 medication. Now, some of the challenges may be if you have been purchasing the medication with an online program that didn't check your BMI and doesn't actually have it documented or doesn't have these conditions documented, that is a concern that that may be a barrier to getting coverage if your BMI is now no longer one of these criteria today, where we don't have the documentation of when you started it. So that could be a little bit of a hiccup. But if you've been monitored by a clinician that is actually documenting the medical criteria that's supposed to be documented as a part of treating obesity, then you should be in a good place to have the information that you need. So, what if you're already getting a GLP-1 through your Medicare Part D benefits, but maybe it's just not as affordable as you'd like for it to be? Maybe your copay is higher than $50. Maybe the deductible is too much for you. The bridge isn't going to help you in that situation. So, this program was created to give patients access to a GLP medication if they have no other options for access otherwise, not necessarily considering the fact that unfortunately for many of us, we may have access through we may have access through a Medicare Part D benefits in terms of it's covered, but the copay may still be more than is within our budget. And unfortunately, the bridge doesn't provide access to that. So if you already have coverage through your Medicare Part D benefit for a GLP medication, so that would be in this situation if we're talking Zepbound, if you have access to Mounjaro, Wegovy, Ozempic, Foundeo, or even if like you have access to Trulicity through diabetes, then you're not going to have access to bridge coverage. So type 2 diabetes, moderate or severe sleep apnea, if you have a liver condition called MASH, so metabolic dysfunction associated steatotic liver disease, right? So formerly known as NASH. So if you're on the medication already through Medicare Part D for those indications, or if you're on it for the cardiovascular risk reduction, then you're not eligible to access the medications for a lower copay being your only reason through the bridge program. So if you are someone that meets the criteria and you're able to gain access to the prescription because the only indication that you have that qualifies you for a GLP-1 by the FDA approved indications is the obesity criteria, then the cost will be $50 a month. And this is every month. There's no exception to this. You can only get a 28 or 30-day supply for your medication. There will be no 90-day supplies. And that just depends on whether or not you're getting the injections or the pill as to whether it's 28 or 30 days. There is no deductible. It's $50 for the first month, and it'll be $50 every month. This does not apply to your out-of-pocket cap. You cannot use the drug payment program for this. And if you have other coupons or low income type benefits that usually apply to other medications that you're on, that doesn't apply here. $50 is the lowest it will go. We're still waiting for clarification about what will happen for individuals that have dual eligible benefits. So if you have Medicare and Medicaid, currently in the state of Wisconsin, our understanding is that you will still have to pay the $50 if you qualify for bridge, that your access to these medications will not be through the Forward Health Medicaid program. It will be through the Medicare Bridge program, but more to come. Again, this just started, so we're learning more. And if you get any feedback, we'd definitely love to hear at Weight and Gold so we can update this for more patients to understand. So it's not gonna be all the GLP-1 medications, just 3 of the medications that are available. Wegovy, both the injection and the tablet. It will include Wegovy HD as well, which is a 7.2 milligram dose. And then Foundeo, the daily tablet, and then Zepbound, but only the quick pen option. The vials and the single dose pens will not be a part of the bridge program. So how do we move forward with this? So we see that we're eligible or we're not sure if we're eligible. Please reach out to your clinician to schedule an appointment, review your circumstances with them, and see if it's something that you may be able to gain access to if you medically would benefit from it. So schedule a visit. Please don't call your doctor and ask them to look outside of an appointment. Anytime you're asking your doctor, your nurse practitioner, your physician assistant to evaluate your medical records, evaluate your condition, consider prescribing a medication. They have to talk to you about risks, benefits, look at your current condition as of today. And all of that really does need to be done as a part of the visit. Plus, we need all this documentation. They have to write you a prescription. So schedule an appointment. And your provider will then have to submit a prescription to the pharmacy, specifically stating within the note, within the prescription, that the prescription should be submitted through the Bridge program. If it gets sent through your Medicare Part D benefits, it's going to get denied, and we may not understand clearly why if your provider doesn't understand that they have to submit it with a note saying submit through Medicare Bridge. All right. And it does seem like, oh, it would be as easy as then you just go and pick it up at the pharmacy, but there's a couple of steps in between there. So when you go to your appointment, make sure you have your Medicare Part D card so the team that works with your clinician is able to have all of that on file so we can confirm that you're eligible. If you're going to a new clinician that may not have been taking care of you for a long time, you may want to bring your records. Or if you've been going to using an online access type organization in order to get your medications, you may need to bring the records or documentation they have so your provider can have access to that to see what your BMI was at the time of start of therapy. A list of any current medications, updated clinical conditions, again, if this isn't a provider you've already been working with, and if you have any denial records from previous GLP-1s trying to get approved. All right, so this is what happens. So then they send in the prescription. Hopefully they've done it right with that note. And so day 0, the prescription is going in. Then the pharmacy has to process it and send it through the bridge processor that has been contracted to handle all of these. That can take up to 72 hours once the pharmacy has sent it forward. And then hopefully after that, within that 72-hour time, your clinician gets a response. If they don't get a response within that 72 hours, your clinician then has to fill out a form that then has to be faxed into the bridge processor's office. And then it could be another 72 hours or so before we hear back. So really give your provider's office at least a week, and that's business days, from the time that you've seen them in the office to expect to get a prescription. Hey, if you're able to pick it up early and the process is much more smooth, awesome. That's what we all hope for. But please don't call every day, because that's just going to slow down the process, because you're just adding additional phone calls and notes and things to the provider's office, and it kind of limits their time to be actually able to follow up on the work that they're needing to do to get the answer to you. I know patience is hard, right? So I just want to remind everybody, clinicians, community, patients, that this is just a demonstration. This is not permanent coverage. So this is July 1st, 2026 through the end of December 3rd, through the end of 2027. So ending December 31st of next year. So what happens after that? We're not entirely sure. So there is this balance program that is supposed to pick up at the beginning of 2028, but the details of that are still in progress. And a lot of this is what we understand is that CMS really wants to see what is the benefit beyond weight loss, wanting to see the improvement in health outcomes and also cost outcomes, because that's what they care about as well. to see what the benefits are in covering these medications. So for you today, if you're thinking you're eligible, or if you just want to find out you're eligible, if you're engaged with a primary care clinician, start with them and just schedule an appointment and say, I'd like to see if I qualify for this. This is something that I think that can be incredibly impactful for my health. And they'll look at your BMI at the start of GLP-1 or today if you've never been on one. Hopefully they should get baseline labs to assess how your overall health is related to your weight. So this can also be monitored over time because we want changes beyond weight. It's not just about the scale. We're trying to improve our health. And that's really what treating obesity is about. And really an open discussion about which drug fits you best. There's multiple options. They all have different side effect profiles. They all have different average weight losses, which the individual person, it can vary with. And different ones may fit with your life and your routine better. So hopefully your provider can have a very good conversation with you on that one. And keeping in mind, if the first one doesn't work well for you, there's opportunity to change to others. Once you pick one, you're not stuck with that one. If you don't have good results or it just doesn't work well for you and it's not something sustainable, then there's options to transition to the other ones, just like any other medication. And if your clinician is not able to help you with it, or it's not something that you feel like they can take on, if you're in the state of Wisconsin, we're happy to help you and see you at Weight and Gold. We are an obesity medicine practice. All of our clinicians are obesity specialty trained and certified, and this is what they concentrate and do all day long, is helping people with their weight health. So we have offices in Watertown and Madison, Wisconsin, as well as can see patients virtually across the state. So we're here to help answer any questions that you may have about, do you qualify for the Medicare Bridge, and how can we get you treated for the clinical disease of obesity, as so many of us have been waiting for this opportunity to improve just how much we are able to enjoy our lives and thrive. So I hope this has been helpful for you. I know it's an exciting time, but it can be a really confusing time if you're not aware of what your benefits are. So like and subscribe if you feel like this has been helpful. Please share, and please continue to follow us on Weight and Gold as we continue to give you updates on obesity, health, science, and what's new and available to you for coverage.